Hello, viewers. Good evening to you wherever you're joining us from. This is your favorite medical show, Ask Dr. Saw. Remember, the show comes to you every Tuesday night at 8 p.m. on the Guyanese Critic platform and on my page also, Akash Prasad, and you can also get it on the page of Dr. Saw. I want to remind you that this show is interactive, and while we carry on our conversation this evening, remember you can send in your questions, and next week we will be answering those questions on our next episode, which is next Tuesday. So remember, even if your topic is related to tonight's if your question is related to tonight's topic or not, it's okay. Whatever the medical condition is, send it in to us, and we will try to get that question out. And Dr. Saw will try his best to answer your question next week. So again, thank you so much for joining us this evening, and joining us from England this evening is our very own Dr. Saw. Thank you so much for joining us, Doc.
Hi, Akash. Thank you again for having me, and it's a pleasure, of course. And to the viewers, good night.
Wonderful, Doc. So this evening we're talking about hepatitis, and I've got quite a few questions to ask on hepatitis also. But to start off this evening, give us an understanding. What is hepatitis? And hold on, one more thing, Doc, before I go on. I'm sorry to interrupt you, but here, when I was younger, I used to hear about hepatitis A, hepatitis B, hepatitis C. Apparently, hepatitis has gone more than that now. So I'm not sure. Is it what's happening? Tell us.
Well, I mean, indeed, they are discovering more and more viruses that are linked to hepatitis, but there are some specific type of viruses that are specific for hepatitis that cause inflammation of the liver. So by definition, hepatitis means inflammation of the liver. Itis is inflammation. Hepatic is the liver. So hepatitis, inflammation of the liver. Now, let us not confuse inflammation with only viruses. Inflammation means something is inflamed. It's, swollen, it's red, it's hot, it's painful. Those are cardinal features of inflammation. But in hepatitis, it is inflamed, and viruses can cause inflammation, among other things. So not only the viruses would cause inflammation, not only the viruses, but you can have things like trauma to the liver, you can have things like alcohol. Is a common cause of inflammation of the liver. There are certain drugs that can cause inflammation of the liver, certain toxic agents, certain venom, certain, any insult, anything, any chemical, any bacteria, infection, chemical, medication is a common cause, as a matter of fact. So those are the causes of inflammation of the liver. But today I want to focus on viral causes, because by far the most common causes are alcohol and viruses.
Okay.
So we will focus today's topic mostly on the viral causes, and then I'll give a little overview on some of the other causes and what we can do about it and how we can investigate it. Possibly, maybe next week. I think hepatitis cannot be covered on just one episode.
Okay.
Maybe we can talk about alcoholics or alcohol-related hepatitis probably next week. Let me see how it goes.
Okay.
But for today, let's we'll talk about the viral hepatitis.
Great. Is jaundice? Well, I remember back in days going to music, call it gandas. Jaundice and hepatitis, yeah. Are they the same? Are they related? Is there any correlation?
Of course. Yes. So what we call jaundice means yellowness of the eye, and that is buildup of bilirubin or bile. Now, jaundice is a sign of hepatitis.
Oh.
They're not the same.
Okay.
So hepatitis means inflamed liver. That's all it means.
Right.
And viruses are common causes. And there are different types of viruses. I'll go through that. And it will give rise to signs and symptoms. So when you have hepatitis, you have signs and symptoms. Signs are things you can see. Symptoms are the things you feel, the presentation.
Right, exactly.
And jaundice would be a sign. So you get yellow eyes, raised bilirubin as a result of that. And that is a sign of hepatitis. But not, it's not only, majority of hepatitis, you probably don't even have any sign or symptoms. So let's go through that a little.
Right. So, but Doc, when I heard that you can actually pick up hepatitis by using a toilet that somebody used before that had that. Is that true?
That is quite true, indeed.
Wow. So,
but okay,
so I want to know some of the causes, man. I want to know how do you get this?
Absolutely. So today we said we're going to focus on the viral causes.
Right.
So you have, I just listed many causes of hepatitis, but viruses, alcohol and viruses are the commonest causes. So you have hepatitis viruses. We call them A, B, C, D, E, and now G.
Wow.
G is like they found that half of the patient with liver failure, they couldn't find the A, B, C, D, E viruses, so they're looking for other viruses, and they found the name set of viruses called G. However, they're not so common. The common ones are A, B, and C.
Right.
So A, B, and C are the common viruses. So if we were to just look at the viruses, as we know, like flu, cough, and cold, they're viruses. So viruses is a microorganism, and they cause infection. Now, hepatitis A and E, they are transmitted fecal-orally. That is, by using the toilet, by contaminated food and water. So A and E, they are we call it fecal-oral transmission, your mouth and your anus, fecal-oral transmission. And so contaminated, you use the toilet, your hands, you don't wash your hands properly, you can transmit hepatitis A and hepatitis E. Thankfully, hepatitis A, does not lead to chronic infection. And less than 1% of people will be severely ill. Less than 1% of people will be severely ill. It does not lead to chronic infection. It's usually a self-limiting condition. Like if you have flu, for instance, it goes away most of the time. It goes away on its own. Same with hepatitis A. It's a self-limiting condition. It goes away on its own. There is no specific treatment for it. It can present like flu-like symptoms. It can give you diarrhea, vomiting, aches and pains in your body, malaise, fatigue. It can cause jaundice, yellowness of the eyes. It can make your urine a bit dark, your stool a bit clay-colored. Yes, so those are the features of hepatitis A. And I would say, thank God, it's a self-limiting disease. It cures itself in majority of cases. In a few patients, less than 1%, they can have, we call it fulminant hepatitis A, where it is very severe, and of course, it can cause liver failure. But that is so rare. I've never seen any hepatitis A liver failure.
Okay.
I've seen many hepatitis A infection, but not hepatitis A liver failure in my close to 30 years of practice.
Okay.
But let us come now. So that is A and E fecal oral.
Right.
E is not as common as A. A is more common. Just quickly a bit on some of the tests you can do. You can do a blood test for hepatitis A. You'll see the liver enzymes can be high. The liver has got markers, we call it enzymes. So when you do that, you see the enzymes are high. Right. And also you can test specifically, we call it immunoglobulins for the virus. And there are two major types, IgM, IgG. Now, there are one that increases when you have the infection and it stays for a few months. And that's the IgM. And then you have IgG, which can stay for years, even lifelong. So I don't want patients to confuse this. They can go to a doctor, have a test for hepatitis A. The doctor say you're positive for hepatitis A. What you need to clarify, is this immunologic test that shows that I've had the infection many years back, or is it an old infection, or does it mean that I have a present infection? because I notice sometimes patients come with results and they need some clarity on that. So it's important they can clarify that with their doctor. Right, that is A. Let us go down to talk about hepatitis B. Now, this is the serious one.
Okay.
And I mean, lots of us probably, lots of people I know don't know much about hepatitis because for majority of patients, it doesn't give rise to symptoms or signs. So 3/4 of the people would have hepatitis and don't even know. They don't have signs or symptoms. But the prevalence, if you were to test, sometimes incidentally, I would do blood tests on patients. I find their liver enzymes are a bit abnormal, and then I will test them for hepatitis, and they're positive. So it is very careful. It's a very serious infection. So hepatitis B is so different from hepatitis A that it is not fecal-oral, so you don't get this from going to the toilet or using the toilet. You get this from drugs, parental use, that is intravenous blood products, blood and body secretions. So like HIV, like AIDS.
Right.
So body fluids, blood and blood products and body fluids, that's how you transmit. So sexual contact and contaminated bloods and needle, for instance.
Wow.
So there are some high-risk patients. So the high-risk patients would be like multiple sexual partners, IV drug users. There are people who have some occupational exposure. So if you're a doctor, you're a nurse, you work in an environment where you're dealing with blood and body fluids. There are patients who have regular transfusion, blood transfusion. Thankfully, nowadays, all bloods are screened for hepatitis and HIV. Back in the days, they weren't screened, and people would have contaminated hepatitis through that. Now, listen to the prevalence now.
Yes.
They say about 2 billion people would have been affected at some point, either past or present infection of hepatitis B. 2 billion.
Wow.
And out of that, about 240 million become chronic carriers. Now, the problem is, as I say, majority of patients, they heal themselves, not an issue. In different percentage, in adult, probably 5 to 10%, but in younger patients, it can go from 30 to 50%, and in newborn babies who get it from their mother, up to 90%, they can become chronic carriers.
Okay.
And out of these chronic carriers, 15 to 40% of them can go on to have liver failure, that is cirrhosis with liver failure, or cancer of the liver. So, it is a serious disease. About 1 million people die each year due to chronic hepatitis B. 1 million deaths a year from hepatitis B. And if I were to say that to you, that 2 billion.
That's right. That's quarter of the world's population right there.
And you would say, hey, I didn't know that this thing is so serious.
Exactly.
And you have 1 million deaths every year due to some sort of liver, either cancer, it can give rise to liver failure, as in cirrhosis, or cancer of the liver. And of course, if you have cirrhosis, the treatment would be a transplant liver. Yes, you can have supportive treatment until the definitive treatment to save you would be a liver transplant. Cancer of the liver, likewise, primary liver cancer. So there are different types of cancer of the liver. You can get cancer coming from spread from a different organ. But what we're talking about is what is called primary liver cancer. So liver cancer can be primary, secondary. So primary can come from hepatitis B. Now, as I said to you, thankfully in the adult population, majority of patients, they cure themselves.
Okay.
And 5 to 10% can go on to have this chronic disease, which then we will have to treat. Now, I talk about the risk groups. What are the signs and symptoms?
So right, I was just going to ask you, because if you're saying 2 billion people got this, and you don't even, sometimes you don't know, then what are we looking for? What should we be looking for?
Well, as a majority of patients, they can have, majority of patients are asymptomatic. Sometimes they get like a mild flu-like symptoms, they don't pay much attention to it, and they could be just having a little viral infection, and they cure themselves. No treatment is like having a little virus, like the flu. You get flu-like symptoms, you cure yourself. Now, other patients, they can have inflammation of the liver, so they get pain in the right upper quadrant. So you know where the liver is located,
right.
under the rib. You can have pain under the rib. They would have jaundice, so as we all associate jaundice with something with the liver. But I'll tell you some other causes of jaundice when we look at that. So they will have yellow eyes. Their bile system will be disrupted. So bile is present in urine and stool. So you can have your color of the stool change, the color of the urine can change, and aches and pains in your body. You can have, it can affect also, there are complications of hepatitis where your body can react in such a way that it produces some abnormal protein that then go and affect your kidney. So some patients with hepatitis, they go on to have kidney failure. Besides liver failure, they can go on to have kidney failure because they develop what we call immune complex. So the protein, it invoke the immune system to produce some abnormal protein that can then go and attack the kidney. Hepatitis also can affect the bone marrow. It can cause your blood cells to be abnormal. Your bone marrow can go abnormal and decrease production of different types of blood in the marrow. So there are lots of, lots of problems you can get from hepatitis itself.
Okay, so
the question was, right, so those are the signs and symptoms, and there are a fair number of people, or percentage of people, who wouldn't have anything.
Okay, great.
And these are the incidental findings. You see a patient coming for a little medical, for something else, they say, doc, check my blood sugar, check my blood kidney function, whatever. You do their liver function and you find that they have raised enzymes. Then if you find an abnormal liver enzyme, I think is almost, almost always I would go looking what is the cause. So if someone comes in for routine blood screening without symptoms, I would, if they're found to be, their liver enzyme found to be abnormal, then I'll go looking for causes. And commonly, I screen for like 4 or 5 things, I will say right away when I'm sending you for a blood test. So I would want to know your liver, so hepatitis screen, we do that. Another big cause for inflammation of the liver is called autoimmune disease. So autoimmune, the body attacks the liver.
Right.
Like rheumatoid arthritis and thyroid problem, they're autoimmune, the body attacks itself. You heard of that?
Yes, sir. Yes.
The body can attack the liver. So autoimmune cause is another cause. Of course, you'll question about drugs, medication. They can also cause liver problem. There are some people who are born with some enzyme deficiency that can affect the liver. For one, antitrypsin. You can have a buildup of copper. So your metabolism, how your body regulates copper. You can have a buildup of copper deposits. Also, our body has got chemical that metabolize iron. So the iron that you eat, if it is affected in that metabolic pathway, they can get iron deposits in the liver, and it damages the liver. So these are the things that can give rise to liver failure. So if you come in, if I were to see a patient with abnormal liver function tests, I would first go in terms of blood screening, hepatitis screening. I check their iron to see if they have iron deposits. I'll check their copper level. I'll check their autoimmune screen.
Okay.
That would be my basic. Probably, if somebody were to ask me, what are the 4 basic tests you'll do for that patient? I'll do their hepatitis screen, that is B and C, usually.
Yes.
And that. Now, however, you would also want an investigation. You'd also want to do an ultrasound.
Right.
An ultrasound scan will look for other causes. So gallstones, we talk about gallstones.
Yeah.
Gallstone can block the flow of bile and it causes yellow eyes. So lots of people can have yellow eyes and you think, hey, this is due to infection of the liver. But it's nothing to do with infection, it's gallstones. You can also have cancer of the liver or cancer of the pancreas. So the pancreas is an organ next to the liver. And if you have a cancer of that, it presses on the flow of bile, the ducts, the tubes that flow the bile, and you can have jaundice as well. So they can present similarly like hepatitis. So, but in those patients, I would say they would, if you have cancer, of course, you would lose weight. It's a chronic disease. Over time, patients are fatigued, they're tired, they're loss of weight, maybe some digestive symptoms, change in bowel habit, nausea, acid problem. Because these are all the liver and the pancreas, the gallbladder, they're all linked together, and they deal with digestion. So when we talk about abdominal pain last week, we talk about how do we relate it with different organs, where it is located, and how you can present. So your signs and symptoms would go with where the disease is and what are they, then you can link, okay, this is due to my liver, my pancreas, my gallbladder. They all can give you gastric symptoms.
Okay.
Sorry, go ahead. What are you going to say?
No, I was going to say, this hepatitis, we take, when you hear about this, we take it for granted. And I'm listening to you talking about this. I'm thinking that this is something serious that we should really be taken into. We should really take it serious. And I mean, we went through all the symptoms. How do we treat hepatitis, though?
Right. So thank God now. So as I say, the common ones. there's no you don't need to treat. B and C are the ones that we will treat. So B and C, they're transmitted like blood and body fluids,
right.
Blood product, body fluids. Now, we treat them with antiviral drug. So they are medication, and I've seen Guyana, they have started probably a few years back. Hepatitis C treatment used to be very expensive. B and C generally used to be very expensive.
Okay.
I even in the UK, it used to cost close to $100,000 generally for a course. When the drugs first came out, for a course of hepatitis treatment. Thank God, through some arrangements, we have hepatitis being treated in Guyana, and the drugs are more readily available, and the public can access that. That is my understanding from the ministry.
Okay.
So I would say to patients, if they are found to have hepatitis, by all means, get it treated, because when you treat it, the virus goes away, or it becomes so undetectable that you cannot transmit it anymore. So remember, if people were to get hepatitis, and lots of times you can get it without knowing, so the risk is you keep giving it to other people. And if you're giving it to other people, all these patients they have a high percentage of them, like more than half of hepatitis C will go on to have chronic hepatitis. And again, those patients go on to have cirrhosis, which lead to liver failure or cancer.
Okay.
So if we're trying to prevent cancer or cirrhosis of the liver, of course you want to target hepatitis B and C, so those are the culprits. And of course alcohol, but that's another topic we'll talk about. But let's say the ones that we can try to prevent, B and C. And so treatment is antiviral. And usually they last for a couple of months, a few months of treatment. There are different regimes and different types of drugs based on the different subclass. So C has got many subclass, genetic type of viruses, genome are different. So then you give that combination of drugs. Now, there is a vaccine for the prevention of hepatitis B.
Okay.
But there isn't a vaccine for hepatitis C as yet. So, because, there are lots of genome and it keeps changing, and it's difficult to get a vaccine for C. So, but they're working on that. But for now, we have hepatitis B vaccine. So I would say to everyone, patients who have got family members who have been diagnosed with hepatitis B, please ask your doctor for the vaccine. Patients who have got occupational exposure. So if you're working in a nursing home, if you're working in a medical industry, if you're working where even in the UK, patients who are working like garbage collectors, those are high-risk patients. They get a needle stick injury. you can get hepatitis transmission from needle stick injury, drug use. Those are high risk, I would say, have hepatitis B vaccination. We routinely give hepatitis B vaccination now to children. So that's your treatment, that's your vaccination. And I would think that we've covered most of the ones. So A, self-limiting, B and C, dangerous one. It's treatable, it's preventable. Get yourself tested if you're not sure, or if any family member has been tested positive, try to test it, see if you're positive. If your liver is abnormal in your blood, routine blood tests, I would like you to talk to your doctor about having that investigated.
Before I go to that question, we have a question from last week that I want to talk to you about. I also want you to go back to me again. Prevention. How do we prevent it again?
Okay, so prevention would be high-risk patients, you would know that. So you don't want to be engaged in high-risk sexual activity. Mm-hmm. If you're dealing with blood and body products, you would have to be more careful. If you have a needle stick injury, there are precautions you have to take. So it's about looking at if their family members affected. You don't share needles, drug use,
right. Yeah.
No needle sharing and all of that. That's one. And prevention is about vaccination.
Okay.
Not for C, but for B.
All right.
And for hepatitis A, it would be vaccination again. There's vaccination for hepatitis A. And of course, good hygiene. You go to the toilet, you wash your hands, so that would be the way forward.
Wonderful. So, viewers, again, thanks. I thank you so much for joining us this evening. We got one question from last week, and we're going to take your questions that you've been sending in. We're going to take those questions next week. So, Doc, the question from last week is, can you drink any med to pass the stone? And I suspect it's gallstone, because we were talking about gallstone around.
Yeah. So I think there's a little bit of when we talk about drinking a med to pass a stone, technically, there is a medicine for gallstone to drink to dissolve the stone. So it's called dissolution with stone, ursodeoxycholic acid. I don't know, it's a big word. Mm-hmm. Ursodeoxycholic acid or ursodiol, Now, the problem is, first of all, it is not something commonly recommended, because for it to be effective, you have to have a functional gallbladder, and the stones that they will dissolve would be what we call radiolucent stones, cholesterol stones, where some stones can calcify and that can dissolve.
Okay.
So there are different types of stone. The drug is generally not used. I think the confusion there is that when you have kidney stone, we will give you some medication to say you pass the stone. Mm-hmm. So with kidney stone, you can have medication to relax the muscles, or dilate the urethra a little and relax the muscles, so that the passage becomes freer.
Okay.
And the stone passes through the tract when you pass urine. Now, you could feel, most people, they will hear the stone click on the toilet bowl, or they will see the stone pass, and some people retrieve the stone. In gallbladder disease, that doesn't happen. You don't pass the stone as you expel the stone. You can expel the stone. Some stones are so huge, so some stone can pass through the duct and go expel into the intestine.
Okay.
Some stones, they can go into the duct, and they're so big, they form a fistula with the intestine.
Wow.
We talk about that, where if it touches the other organ, it forms a hole in it, and it just gets extruded into it. But so the medication that is used, one, it is not commonly used. It's only in selective patients who cannot probably go through surgical procedures. The medication has got side effects. It can cause diarrhea, and you have to use it for a long time, for months. And also, you have a recurrence. So when you stop it, the stone comes again, because the underlying cause is there. Okay. So generally, medication is not warranted. And how the medication works, by dissolving the stone, more or less. Okay. Not by expulsion.
Okay. Well, thank you so much, Doc. Viewers, thank you so much this evening for joining us. I hope it was an interesting show. I was, I'm sitting here and I'm listening to all of this and saying 2 billion people suffering from this, and we got to take our precautions. Doc, anything from you in closing?
No, thank you again, Akash, and I'm happy. Hopefully, I'll be back soon, and we can go back to our calling program in terms of live. But
okay.
For now, I think we work with our,
yes,
internet.
What we have, yes.
Send the questions through, and then we'll take it from there.
Indeed. And
Thank you.
Doc, a lot of people have been asking where is your clinic located. I hope when you come back, if you'll be able to take up back a spot so that some people can come to see you also.
Yes, I'm more than happy for patients to contact me through you the same way with anonymously. You can talk about some of the symptoms you're getting, so we can do cases.
Indeed.
Patients can put, some of the symptoms and presentation or even their blood investigations. I can go through them and give some opinion if they can't get to see me.
Wonderful.
But I'll be more than happy once I get back. I'll work something out.
Brilliant.
Thank you again, Akash, and to the viewers. Good night.
Indeed. Viewers, thank you so much for joining us. Remember to stay healthy and stay safe on the roads. See you later.